Around the world, there are massive gaps in the healthcare system affecting patient access to proper medical care. The resulting statistics around issues such as incidence of cervical cancer in the Latinx population in the Rio Grande Valley and maternal mortality rates among Black women show that these disparities are a matter of life and death.
This time that we're living in, where we see the birth disparities between different communities, specifically when we talk about United States and Black women, Native American women, and then white women. Black women and Native American women are more likely to die during childbirth or due to childbirth-related causes, more likely than their white counterparts.
A lot of the disparities in the United States are due to women having insurance or not having insurance. I think that's sort of the first part of it, because if they can't afford to get the care, then they're not going to. I've had patients who have sold their TV and jewelry to have surgery. I mean, it's a reality. The rates for Hispanic women, they're actually 40% more likely to have cervical cancer than non-Hispanic white women, and then have a 20% higher chance of dying of disease. The Rio Grande Valley is an area right along the Texas-Mexico border, and the population in the Rio Grande Valley is actually about 85 to 90% Hispanic, so mostly Mexican American.
Everyone deserves the same quality and access to care, and luckily there are patient advocates out there working to ensure they get it. For some, like Dr. Andrew Besteris and Tracy Ann Hoagland, the desire to help people started with their own medical struggles.
I grew up with really poor sight, and my teachers just thought I was being lazy or that I wasn't particularly smart. And everything changed when I got my first pair of glasses at the age of 12. And I never knew to that point that I couldn't see, and no one else could tell that I couldn't see. And that's one of the problems with poor sight, is it isn't obvious to anyone, including the person with poor vision, maybe until it's extreme. And if you grow up with it, you haven't known anything different. If I hadn't, at the age of 12, got an intervention in terms of glasses, which cost maybe $30 to $50, I would not have gone on to get good grades at school. I would not have gone on to become a doctor. I would not have gone on to have this privileged position of being an educator and the leader of a social enterprise, which now employs 40 people, and we are trying to make an impact around the world. So those things just wouldn't have been possible.
Having the trajectory of his own life shaped by simply getting a pair of eyeglasses had a profound effect on Dr. Andrew. And after becoming a surgeon, he started digging into the causes behind the global issue of blindness.
The latest data, which came out in 2020, is that around 1 in 7 people on the planet have some form of vision impairment, about 1.1 billion. And within that 1.1 billion, there's 43 million who are blind. Around 80 to 90% of them could be cured today if they could access treatment.
Faced with a problem whose solution wasn't getting to the people who needed it the most, Dr. Schmeller and her colleagues have sought to advocate for the community in the Rio Grande Valley through innovation.
2014 is when we first started, and we've expanded to many more clinics. We started with one clinic in the Rio Grande Valley, and then have expanded to other clinics, and then also to other parts of Texas, because the problem is really the same everywhere. And so we've increased the number of medical providers who are trained to provide colposcopy and LEEP. So that's been really exciting, because now those women can get the treatment they need closer to home. Through the program, there's been over 14,000 women screened, which has been really exciting.
The potential return for a child who's identified at school age and given the opportunity to see who wouldn't have can be in the order of 150 times the investment upfront needed to do it over the lifetime of that child. The implications are huge, and there's very few things on the planet which can unlock human potential better than giving someone the ability to see the world clearly.
As a doula, Latham Thomas feels the fear of women who don't want to become a statistic, and she has some sound advice on how to find a way forward.
The conversation that I have is really more about grounding in our wisdom of the body, grounding in, the fact that like people did this before us, that you're not alone, that you are like stepping into a lineage with other people who have done this for thousands and thousands and thousands and thousands of years ahead of us. And so it's like, we've been doing this, like we are all part of, this new journey into motherhood or parenthood. You are not alone in this. You are not alone in thinking that something could happen wrong. But one of the things that I have people do is start phone fasting. So I think for a lot of people, the information is alarming and makes them think that something's going to happen to them. And if you're taking in all this information constantly in the news cycle, the signal is that something will happen to you. That's the signaling. There's a certain point that you have to decide that you're going to continue to live. Part of your resistance is living. Part of your resistance is thriving, even in the face of all the things that are happening that can be, that can destroy, right, us and our community. So it's like, you have to pray and keep walking. You have to be in relationship with joy.
Tracy Ann Hoagland wasn't deterred by her experience at the doctor, and has since worked to advocate for other members of the deaf community.
When I was living in and working in Kenya, there was this incredible moment where two ladies who were best friends were sat next to each other, and they'd been sat together for about an hour without even knowing they were sat together. And they'd lost contact with each other for about 10 years previously. The reaction the next morning when their eye patches came off was two ladies that looked old and couldn't move, and they suddenly looked young, and they got to their feet and they threw their sticks away and they danced.